Hello, my name is Brenda Sims, and I'm the administrator here at Clear Passage Physical Therapy. I have with me today a patient that was seen at our clinic in Canterbury, England, and her name is Aoife Duffin. Hi, Aoife. How are you doing today?
Hi, Brenda. I'm very good. Thanks. How are you?
I am doing great. I am doing great. Thank you so much for coming on with me today and to discuss, your treatment and how you found out about Clear Passage. So,
Mhm.
can you tell me, how was your infertility journey? How did it begin?
Um, my partner and I decided to try and have a baby, which I don't like using the word try because it's not useful. But we started that journey of January last year, not this year, around about then. And then maybe, but it wasn't very, we weren't being very sort of targeted about it. We were just testing the waters, as it were.
Mhm.
And then maybe 4 or 5 months in, my menstrual cycle went missing for a month.
Mm.
And that scared me because I was feeling a little bit off kilter,
Mhm.
sort of feeling like PMS symptoms and maybe hot flushy kind of things. But that I never got to the bottom of that. Well, I did actually. Sorry, of course I did, because I took myself to the doctor, and I I actually said to them that I was scared that I was going through early menopause.
Mm.
So I had a lot of anxiety around that, and because we started trying to have a baby, I thought maybe this is something that's not going to happen for me. And so I got a test, and the nurse came back and said that I was going
Mm.
through the menopause.
Mm.
And I was absolutely devastated. And she said that my FSH levels were that of. I tried to decipher then whether I was where in this menopause story was I, because there's peri, there's pre, there's all of this. And she didn't
Mhm.
really know. But she said my AMH was very low and my FSH was very high. So then we rushed to a sort of private London fertility clinic, and we were told that I had this thing called POI,
Mm.
which I'd never heard of before.
Mhm.
And the woman there said early menopause is not really the right word for it, but it does mean that you have quite a small chance of becoming pregnant,
Mm.
that
Okay.
your ovulation is kind of all over the place. And so I was devastated some more. And I think very shortly after that, I have to hand it to my partner. He YouTubed
Mm.
POI success stories,
Mm.
which was quite
Okay.
a good thing to look for.
Mhm.
And the very first thing that came up was a woman that you must have had through your clinic, who was diagnosed with POI and had become pregnant. And we were like, okay, we thought this clinic is in America, or there's a handful of thoughts. We thought, so maybe we'll be getting a holiday to America. But we discovered that there was one in Canterbury, which was like a 30-minute drive from where we were living. We were living in Kent at the time.
Oh,
So
that's awesome.
very, very sort of fortuitous. And then on the end of January this year, I we went and had the treatment.
Mm. Okay. And now you are
Now I'm
7 months pregnant.
30 I'm 35 weeks pregnant.
That is awesome. That is awesome. So POI is actually premature ovarian insufficiency.
Yes, premature, yeah.
Okay, which means you lack the proper amount of eggs to conceive.
Premature ovarian insufficiency, yes. So your AMH, being your egg count,
Hmm.
looks to be very low, and your FSH alongside that can be very high, which I think is they my numbers were about 40 to 50. I got a few different tests, and one of them said I was 40, the other one said I was about 50 on the FSH scale, and I think they maybe say that the healthy right place for them to be is about 10.
Okay. Okay.
So it was terrifying.
Yeah,
Yeah.
I can only imagine. I can only imagine. So you say your partner found clear passage by just Googling POI and we popped up. Okay. How was your
Infertility.
scheduling process when you contacted the office here?
Um, how was the scheduling? It was great. I mean, we had to figure out finances then, and um, I think we tried to take the next possible slot, which was the end of January. Maybe that was about September, October. It was around November. Maybe we started talking to the clinic.
Okay.
And I think a slot did come up in December, but we just didn't have our ducks in a line to do that. So
Mhm.
there was a January one that worked, and it was great. And actually, we were very lucky as well, because there was a deal at Christmas that time where we got a nice slice of the fee off, which really helped us, because it's great.
That's
And
wonderful. Wonderful.
yeah,
Well, I'm glad we were able to help and get you in.
yeah.
The success that came from that. Also, if anybody has any questions, we will answer all questions at the end of this live. So if you have any questions, you can put them in the comment section. Okay. So tell me about your treatment when you went to the clinic in Canterbury.
So like I say, it was about a half an hour drive from where we were, but still we decided to like get a cab there every day so that we didn't have to think about traveling. So we were able to travel every morning. We didn't have to like go and stay in accommodation. We could go home every evening, which was amazing.
Mhm.
Um, Becca was our main, Becca in Canterbury was our main um, person doing treatment on us. But Tracy Miles, who is the head of the clinic there, she came in. To be honest, she came in a lot more than I thought she was going to. I
Mhm.
had days where the two of them were working on me, which
Awesome.
I felt very lucky to have that. And the
Mhm.
week was it's very intense. It's like, you're I think 4 hours a day of
Yes.
getting this treatment, and but it is intense, but you can just tell that it's something that your body is loving for the week,
Mhm.
really.
Mhm.
And I was very emotional some days. It can do that to you, I think. um there was one particular day that um I could literally feel. I'm saying this before, that I could feel fascia in my shoulder moving back into its right place, and
Mhm.
so she was working on my left shoulder and my left rib, and it was just incredible, really. So it's like a full body massage, but like really specific, and she's listening every day. She would check actually the top of my head to see which way I was leaning it. So she was like a little magician. She was able to tell by just putting her hands on me where there was tension and what areas needed to be worked on.
Mhm.
Um, and my partner was there every day as well. They allowed him to sit outside the door and just work on his laptop. Um, yeah, it was brilliant. I loved it. I feel like people without injuries, without any issues, everyone could do with a clear passage treatment once
Right.
a year or something for a
Yeah.
week.
Mhm. I mean, because we have patients that come for a specific diagnosis, but we do full body. We work from your head all the way down, so it's not just one area that we are working on. We work on the full body. So, have you noticed any positive effects other than your pregnancy after the treatment?
Like I say, that day when she worked on my shoulder and my left rib, because what Tracy had said actually was that, because I had this knee injury from work, um, from 6-7 years ago, that has given me pain on and off since then. It's never really gone away. There's a little cyst there at the back of the knee. Um, they had said that I was kind of crumpled in, that my body had compensated in other ways, and so that it was like they were uncoiling me. So in terms of like my neck and my shoulders, I definitely feel like that has been just worked out. Yeah, I feel like I've been rinsed. Like I don't know how to describe it. Like uncoiled. Like I had so much tension from my work, from like I was telling you, being a theatre actress, living on adrenaline every night and playing roles where I was playing traumatized, brutalized characters and who were literally being physically sort of brutalized on stage by other characters, but for performance purposes. But my body had remembered so much and had retained a lot of that stress. So that I can feel that's been that the clear passage treatment was just perfect for me. Yeah, for having had that for years. Yeah.
Good, good. So would you recommend clear passage to anybody? And what would you tell them about, what you experienced when you came to clear passage?
I mean, I definitely recommend it. I've said to friends that who are not trying to have a baby that everybody should get it. But I would, I watched one of your Facebook lives with, I think she was a dancer actually, the woman that you talked to, but she had a baby at the
Yes.
time. And you had asked her, oh, how long was it before she became pregnant after her treatment? And she said 2 weeks. And I remember thinking, oh, that's never, like, that won't be me. But it wasn't really that long because it was the end of January and I was pregnant by the beginning of March, which was shocking. But yeah, to answer your question, I would definitely recommend anybody to do it. I mean, we just hold. I'm a real believer in the emotional body, the connection between the emotional and the physical, and how we hold on to things in our body physically. So I would just couldn't recommend it enough.
Right. Well, thank you. We appreciate that. Appreciate that very much. So, I mean, what do you want to talk about? I mean, what do you want our listeners to know today about Aofie, about your journey with Clear Passage, and about what you plan on doing in the future?
Well, I think that's like I said to you beforehand. I'm not someone that, I mean, the knee injury was a big trauma actually, and I do feel like it did affect physically the rest of me. And it's a strange thing to say to people that, even trying to explain to people that I was going for physiotherapy for fertility. I think some people find that even that was kind of quite unusual.
Right.
But like I say, there's the emotional side of it, and the holistic side of clear passage to me is much more of a I just believe in a holistic treatment a lot more than treating one isolated area. Like when people have fertility treatment, a lot of the time they are just treating that one area, that the issue with endometriosis or whatever it might be. I remember hearing Larry talking about, I don't know, is it craniosacral stuff about like releasing stuff around that tension around the head, because it helps with blood flow with the pituitary gland, between the pituitary gland and the ovaries. And that to me is it sounds so obvious. I feel like, but it's not. That's not the kind of approach that fertility clinics have.
Right.
So because I had a lot of tension in my neck, and so yeah, it was great. I mean, yeah.
Okay, so we touched a little bit on the scheduling process, and I know that we have the two scheduling ladies here in our office. So which one did you talk to, and how did you come across? How did she come across to you when you talked to her?
I think it was Heather.
No.
Um, I'm so because this was a year ago, or
Uh-huh.
it's or nearly a year ago,
Okay.
and my where I was in my head at the time is completely different to where I am now. But
Right. Hmm.
I mean, it was just easy. I just feel that it was all kind of meant. The Clear Passage story for me was meant to be. Like I
Hmm.
say, it was. We just found it so mad that it was only 30 minutes away, and it's such a niche kind of treatment.
Right.
So the emails were just picked up immediately, and we just got it. We got booked in as soon as possible.
Hmm.
There was great, a perfect flow to it. I didn't, and everybody was really nice. Yeah, yeah.
Well, that's good. We do have a nice team. We have a good team that works very well together. And we do everything we can to try to help our patients, potential patients, get in and get the treatment they want.
Mhm.
Is there anything else you want to talk about? I mean, anything you want our listeners to know today?
Um, Let me think. No. I mean, I think be right if you are going to do the treatment, give yourself because like I was saying, I cried quite a bit on
Hmm.
the table, and I think that's like the physical, emotional stuff that was released.
Right.
Um, and yeah, so be prepared to kind of for stuff to come out maybe. Um, but what would I say? I would say keep an open mind, and yeah, because like I say, when I heard that lady had gotten pregnant, I thought that definitely won't be me, and I don't want to sit here saying that it can definitely work for everyone, but I just think from a regardless of fertility, from a um, getting an overhaul on your body and your mind, I think it's just a beautiful thing to do for yourself.
Right. Hmm.
Yeah.
Wonderful. Okay. Well, I don't see where we have any comments. So we don't have any comments, no questions to answer. I thank you, Aoife, for coming on with me today and, doing this Facebook Live with me and telling people about your experience with Clear Passage. And I am so very happy that you are pregnant and you're having a little boy, you say.
Yeah. Yeah.
I am very happy for you. If anyone wants to talk to us here at our office, you can reach us 352-336-1433. You can go to our website, which is www.clearpassage.com. We're here for you all. And I do have one comment from a Serena. She says, congratulations.
Thanks.
And Amy Phillips, who works here in the office, says, congratulations, Aoife. She is very happy for you.
Thanks. I think I talked to Amy. Yeah, yeah.
Yeah. And Jessica says the same thing. Congratulations. She's so happy for you. We are very happy for you.
Thank you.
We feel so good when we know that we've done something to help someone reach a goal in their life. And this
Well,
is, what you wanted. You wanted to be pregnant. And from what you told me earlier, your pregnancy is going pretty good. You don't sound like you've got morning sickness going on. You seem to be easing right on through your pregnancy. Oh,
yeah.
Becca. Becca, your therapist says congratulations, Aoife.
Is she there?
She is on Facebook with us and she says
Ah, hi,
congratulations.
Becca. Aw,
That is
I
sweet.
miss you.
Becca
I,
says thank you so much for everything you did to help her.
well, I actually said to her by the end of the week, I was like, "Can I just bring you home and have you like massage me every day?"
I do have one question from Serena. She said, how long did it take to get pregnant after treatment?
Um, it was like a month.
A month? Okay. Okay.
Mhm.
So not long at all. By the time you got home and your body got used to the changes it was going through.
Yeah, I was. I mean, obviously, along with clear passage, I was neurotically. I had dietary things that I was trying to stick by and doing acupuncture, and I had also done some Maya abdominal massage, which is quite similar to what some of the clear passage abdominal massage, which I'd heard can help with like stagnation and blood flow and all that kind of stuff. So I
Mhm.
was doing other complementary treatment, and I was following someone called Amy Raup. We had just started like a 6-month fertility um, group coaching program, it's called, and I started that in February, but I then became pregnant really quickly.
Mhm.
But I had been following some of her advice in terms of supplements, and she'd written a book called "Yes, You Can Get Pregnant." So
Mhm.
I was looking at that. Um, so there was other things I was doing. I was yeah, and actually, clear passage is something that I saw in another book called by Alisa Vitti, who is like a kind of a hormone expert,
Okay.
who I had also been following for quite a while. Um, what was the book is called Woman Code,
Mm.
and clear passage is in. She recommends clear passage treatment in that.
Oh wow.
Um, so uh, and yeah, there was something else I wanted to say. I can't remember. I've got baby brain.
Baby
Um,
brain.
um, the lady that we found the POI success story, who said that she had clear passage treatment after being told she had POI.
Hmm.
She actually said that she had quite an easy birth
Mm.
after having had the treatment. So I'm really hoping that that's
All
what
right,
I
we're gonna
mean.
cross our fingers for you for to have an easy birth.
Yeah, yeah.
But you
Thanks
know
God.
what? It's going to be well worth it in the end, though. It will be
Yeah,
well worth it
yeah,
when you hold that baby and
yeah,
you look down into his eyes. You'll be well worth every push and everything else you have to go through.
yeah. Hopefully.
Rebecca said it was so lovely to see you, and you are an absolute pleasure.
Aw.
Becca Becca is a good one. I remember when she came here for training, and she's a very nice therapist and very nice person. So you
Yeah,
were
she was
you were in good hands with her and Tracy.
oh, like I say, I felt like she has a touch of a magician about her, because she kind of was able to um she just was able to tell things by just placing her hands really gently on me, which was amazing, because I don't know how she does it, what she does. And it was all very gentle as well. Like um some of the one of the days I think Tracy did a kind of like twisted me a bit, which was more full on. But most of the time, the it was the use of the massage treatments was all very gentle.
Okay. Okay. We're good.
Um, so I don't know what that's worth, but
Well, I appreciate it so much, Aoife. And take care. And please let us know when the baby is born. We want to see pictures so we can, put him up and let everybody see your beautiful miracle baby that is a part of Clear Passage.
yeah,
You will
thank you so
always be
much.
a part of our family here.
Thank you so much. I really appreciate everybody there, and thank you for yeah. I'm so glad I found you.
Okay. Well, and then guess Serena says she plans to come in December if it's an opening. Serena, you give us a call and we'll take care of that for you. We will get you into one of our clinics in December if you want to come.
Okay.
All right. Take care, Aoife.
Thank
Have
you
a
so
great
much,
day.
Brenda.
Have
Thank you.
another, what, 5 weeks of pregnancy left, huh?
Apparently 5 weeks, but who knows what's going to happen.
Well, you're going to have a round of Thanksgiving, baby. So that's going to be
Yeah.
wonderful.
Yeah. Thanks.
Well, you take care here.
Mind yourself. Okay,
Okay.
bye.